Hello everyone, today we'll talk about how we can prevent left ventricular hypertrophy of the heart. So remember, the heart is a muscle, and when we work out a lot, athletes, bodybuilders, our heart muscle has to pump more blood into the body. And this leads to more heart hypertrophy, especially in the left ventricle. I'll get into that in a second. Quick disclaimer, this is not medical advice, this is entertainment only. So remember, as we work out, we have to pump blood in our body. The harder we work out, the harder the heart has to pump blood to oxygenate basically the rest of our body. And I will quickly draw how this works. So we have our blood without oxygen coming into our heart in the right atrium. And from there, it will go into the right ventricle. So the ventricle is here, and from there, the blood will pass to the lungs. So this is very simplified. And from the lungs, so we will load the blood with oxygen in the lungs, and the oxygenated blood will come back into the left atrium. So the left atrium. And from there, it will go into the left ventricle. Left ventricle. So here, the left ventricle will pump the blood to the aorta. The aorta being the main blood vessel providing blood supply, oxygen supply to the rest of the body. So this left ventricle is crucial, okay? And this left ventricle is surrounded by myocardium, okay? So this is myocardium. And myocardium is basically, myo means muscle, and cardium means from the heart. So it is heart muscle tissue. So every time we contract, this muscle is basically helping us to pump the blood to the rest of the body. So when we work out harder, this muscle will grow bigger and bigger. And let's say this is the left ventricle, very simplified representation. Then it can grow so big that it can get stiff, and the efficiency of pumping blood to the rest of the body gets impaired. And this can even cause heart failure if it is too pronounced. So this left ventricular hypertrophy can happen if somebody is training a lot. It can accumulate over the years, and this is a physiological response, which is okay to a certain extent. But if it grows too thick, if the wall of the left ventricle of the heart grows too thick, it can be very dangerous. Another thing that can lead to the left ventricular hypertrophy is high blood pressure. High blood pressure can also thicken the walls of the heart because we have to pump so much harder. So in order to, well, and this condition is pathological. Okay, so if we train a lot, this is physiological adaptation. But if we have a thickening of the left ventricle due to high blood pressure, this is a pathological adaptation. It can also go hand in hand. Some people train hard and have high blood pressure, and this can lead to dangerous conditions. How can we prevent excess left ventricular hypertrophy? If it is due to too much training, we can reduce the amount of training, and we can, to a certain extent, reverse the left ventricular hypertrophy. If it's due to high blood pressure, we can use preventive measures such as the introduction of blood pressure medications or decrease of sodium weight loss, and all this will help to reduce blood pressure. If you reduce blood pressure, then slowly the left ventricular hypertrophy can also go back, and we can have healthier levels of myocardium in the left ventricular and avoid the excess stiffness of the left ventricle. So again, two reasons for left ventricular hypertrophy: training, blood pressure, high blood pressure. To a certain extent, the excess muscle in the myocardium from training is okay. If it's too much, it has to be monitored. Blood pressure, pathological, so this is not good. It makes the heart of the wall of the heart bigger. We have to prevent that. Medication, sodium, salt reduction, or body weight reduction, good measures to reduce blood pressure and therefore the thickening of the heart. So I hope this was helpful, and always monitor your health parameters. You might want to check your heart. You can do that at a cardiologist. He will tell you if you have an enlarged heart or left ventricle hypertrophy and which extent it has. If you have to take countermeasures, and if you're training a lot, you can reduce training volume. If you have high blood pressure, you can take several measures against or to improve your blood pressure. So thank you for watching, and I see you next time.